I'm Claudia Cooper. I'm a senior lecturer at University College London in old age psychiatry. Dementia is a group of conditions where the main problem is a difficulty with memory or other areas of thinking, so orientation, for example, or ability to express yourself through language. And these problems are sufficiently severe that it causes difficulty with your everyday life. Sometimes when we get physically ill, particularly older people, they can have a problem with their memory and thinking when they're physically ill, which goes away when that condition gets better. But with dementia, these are problems that don't go away when you treat physical causes. It's true that as people get older, they're more likely to get dementia. So if you're 65, around about 5% of people over the age of 65 have got dementia. If you're 80, about 20% of people over 80 have got dementia. And that's led some people wrongly in the past to think what we often hear as doctors is, isn't it just old age? And of course, if 20% of people over 80 have dementia, that means 80% don't. So it's not just old age. Some people have genetics play a part. If you've got dementia in your family, then you're more likely to be at risk of it. And so do things like your physical health. So if you have a stroke, you're more likely to have dementia after that. And there is increasing research which suggests that perhaps what we eat and the amount of exercise we do and how much we are cognitively active and lead stimulating lives might also affect the likelihood of getting dementia. Said about vascular problems where you can have a stroke or a mini stroke, and what's happening there really is that an area of the brain is dying because the blood supply is compromised, and that happens in vascular dementia, but it also probably contributes in part to a lot of dementias. A lot of people with Alzheimer's actually have a mixed Alzheimer and vascular dementia. With Alzheimer's disease, it's the same thing. Ultimately, the brain processes cause brain cells to die and therefore they no longer work, which is why you get the symptoms. With Alzheimer's disease, it tends to be an accumulation of a protein called beta amyloid, which causes the cells to die. Well, at the moment, there's treatments that we can give, but we can't cure. There's lots of research going on with trying to find a cure for dementia or something that will stop the disease in its tracks, but we haven't got that yet. There are some drug treatments that you can give to Alzheimer's or Lewy body dementia. You can give a group of drugs called cholinesterase inhibitors. So quite a few people have heard of donepezil Aricept, which is one of the more common ones. And that can help to stabilise the condition and treat the symptoms. There's also something called cognitive stimulation therapy, which is where people meet in groups and talk about things like what's going on in the news. And it's all about stimulating the mind to help deterioration. And that's an evidence-based treatment. Generally, anything you can do to stay socially and mentally and physically active tends to be helpful. Most of the drugs are cholinesterase inhibitors, and what they do is they increase the amount of a chemical called acetylcholine in your brain. Acetylcholine is a drug that's very important in memories, in generating memories, and in Alzheimer's disease the concentrations of that decrease. So these drugs stop. So it stops that chemical being broken down so much, and so that helps the symptom of memory. People with dementia do tend to live less long than people with the same physical health problems the same age without dementia.